A very good morning to all of you. Good morning, sir. I'm Manisha from the members of PANCHAJANYA, organizing the lecture series 8. Uh, by saying the quote, it requires big heart to teach small minds. I offer my warm welcome to Dr. Nayan, sir. Welcome, sir. I'd like to give a small introduction about PANCHAJANYA. Panchajanya is the divine couch of Bhagwan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing the Bharatiya culture, accepting our roots, and making people realize the truth essence of Ayurveda, not only as a treatment modality but also as a way of life. All these walking in the path of Dharma. Hence, our motto is Shrayam Bharatiyam Arogyam Ayurvedyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharata Rashtra and values to all the Shastra of the people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field. Hence, they aim to make people aware of this and also try their best to solve this on the go. This is an organization that is created by 28 young, energetic individuals of 21st century. Where all have left behind their differences, insecurities, and have come together united for the betterment of this great nation and its heritage as a whole. We at Panchajanya recognize each and every individual's true potential and make sure they reach their maximum. Everyone who is part of this family performs on their own will build within the limits of service and contribution. When one becomes part of this organization, he or she will surely feel proud and honored when carrying out the activities. Weakness become the strength when all are united in the process of progress, in the process of doing good for the society, and that's how the environment is at Panchajanya. No one is considered superior or inferior to any, and all will get a chance to show their interest, love, and devotion towards Bharat and her rich legacy. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficacy in the modern era, and link with current ongoing affairs, its revival, and most importantly, bringing everyone together in working towards establishing a strong system. In order for all these to be achieved, we have set up various wings with working principle and objectives that help achieve the goals faster and easier in the coming years. They are Ahil- Ahilyabai Wing, Swami Vivekananda Wing, Karnataka, Karnatabhala Wing, Govardhana Wing, Ashwin's Wing, Narada Wing, Kautilya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and people from almost every single occupation available aiming at working together and bringing forward the true essence of Bharat and her traditions. So all those who fit under these categories are welcomed with honor and privilege. So I welcome Dr. Nayan sir. He is going to take the topic Navajatha Shishu Pariksha Garbha Vridhi Karma today. So, sir is currently working as Associate Professor and Pediatric Consultant, Department of Kaumara Vidya at SDM Hassan. He has been Chief Consultant Srivatsa Ayurveda Clinic in Srivatsa Ayurvedic Clinic, Hassan. He has secured first rank in post-graduation entrance test in 2008. He has been resource person for 11 scientific seminars. He has done his 8 paper presentation at national and international conferences. He is recognized guide for PG course and recognized examiner for UG and PG in Kumar by Rajiv Gandhi University of Health Science, Karnataka. Sir has been awarded SDM Bishop in 2022. Sir has received Pattabhisheka Award in 2008 by Dr. Virendra Hegde. Sir has been recognized amongst SDM Top 10 Doctor Award in 2019, 2022 and 2023. We welcome you, sir. You can start the session.
Thank you very much for nice introduction, and hats off to the whole team of PANCHAJANYA for the splendid effort towards bringing out the old heritage of Bharat.
Thank you, sir.
Going forward, whether PPTs are visible now?
No, sir, it's not visible now.
Now is it? Is it visible?
Yes, sir, it's visible. Now you can start the session.
Okay, again, as it is a session of exam orientation for third professional students of BAMS. So we will see how we have to present the topic of Navajatha Shishu Parikshana and Masanumasika Garbha Vridhi or monthwise development of fetus in the exam point of view. So going ahead, so it is an important syllabus point which makes the part A or Navajatha Shishu Parikshana or the healthy care of newborn part much dynamic. So Navajatha Shishu Parikshana or the examination of newborn is heart and soul of newborn care, and even in the question paper of university examination we get frequent questions on the topic of Navajatha Shishu Pariksha or examination of newborn. Under this there are many possibility of questions of different magnitude. So just for a few examples can be explain in detail Navajatha Shishu Parikshana. So this may be appearing for long essay question, that is of 10 marks, and write in detail regarding newborn examination for 10 marks, or directly newborn examination can be asked as such. It may be for 5 or 10 marks depending on the marks we have to write, how much we have to display in the answer sheet. Then newborn examination in Ayurveda, where Ayurveda part can be asked separately, so it may be for 5 or 3 marks. Then sub questions, sub topics of Navajatha Shishu Parikshana can be asked for 5 or 3 marks. Those may be write in detail about neonatal reflexes or primitive reflexes or APGAR, just for a short essay. It may be asked for 5 marks or 3 marks. And assessment of gestational maturity, this question is very important and frequently asked, even in case of Viva it is very important, and it can be for 5 or 3 marks. Ballard scoring can be asked for 5 or 3 marks. Normal vitals of newborn can be asked, or Morrow's reflex separately. individual reflex. Neonatal reflexes as a whole can be asked for 5 marks, or separately Morrow's reflex can be asked for 3 marks. So going further, we have Navajata Shishu Parikshana described in our classics very well, especially in Charaka Samhita and Kashyapa Samhita. Kashyapa Samhita Sutra Sthana and Charaka Samhita Sharira Sthana. So for considering UG students, the description of Kashyapa Samhita, I have taken it second, but description of Charaka Samhita, which is short explanation and clear explanation, I have taken it in forefront. So after Namakarma Samskara, Charaka says, Vritte cha Namakarmani Kumaram Parikshitam Upakrameta Ayushaha Pramana Jnana Hetoho. So we have to understand the aim of examination, newborn examination at this juncture. He says Ayushaha Pramana Jnana Heto. So that is the capacity of the competence of the baby to live longer. So in precise, in nutshell, you can understand it as health status of the baby is elicited through this process of Navajata Shishu Parikshana. And Kashyapa in Sutrasthana, he explains in detail regarding examination of newborn for the purpose of eliciting Ayush health status of the baby. So there he narrates whole chapter in the form of answer for 5 questions, like what are all the lakshanas of Ayushman Bala, or the baby who can live longer. Then what are all the features of diseased child and healthy child, that is Sukhino Dukkhinah Kaihi. And so what children, babies with what features are considered as Anayusha, and so what are all the sattvas of the baby. So this is in short the questions what is asked in that chapter, and later he goes on explaining in detail regarding the features of baby who is healthy and who may be prone for some diseases in future. So these are all the things elaborately he explains. That's why we consider it little bit out of scope of UG BAMS children. So in this slide we will go through the explanation given by Acharya Charaka for the examination of newborn. He says, first and foremost, he goes from head to toe in explanation of newborn examination. First and foremost, he explains regarding Kesha. So, how the hair should be. Hair should be Ekaikaja, Mridavo, Alpa, Snigdha, Subadda Mulaha, Krishnaha, Kesha, Prashasyante. So, what he says is, the hair should be discreet enough, that is Ekaikaja. Then, it should be Mridavo Alpaha. So, it should be pleasant to touch. So, what we say in the examination of newborn regarding texture of hair, that is silky texture, and it should be snigdha, so it should be lustrous. So in the slide also you can see the in case of term babies and in terms of preterm babies where the hair features are rough and lustreless, so snigdha signifies lustre. Then Subadda Mulaha, these should be firm and well pigmented, Krishnaha. So those are considered as Prashasta or good. Then he comments on the Twak, that is, it should be Sthira and Bahala. The skin should be firm enough and it should be thick enough. Here the thickness of the skin directly indicates the skin along with the subcutaneous tissue. So that is in case of term babies with appropriate for age babies, we see such type of skin wherein in the right side image you can see the normal skin of the baby, whereas in the left side image you can see it is reddish, it is thin, it is fragile, wherein we see in case of preterm babies. And in case of IUGR babies also thickness of the skin is lessened because of the absence of subcutaneous fat below the skin. So these are some relevant parts, some highlights of Charaka's description of Navajata Shishu Parikshana. Then he says, I will not go into all of those because those will be dealt in your routine classes in detail, and this is not a bypass way to study in the online media, but you all the students should attend the classes regularly, and this is just an orientation towards the examination purpose, how we have to present. So you need not to write all these features in the exam answer. So just you should be giving few of the examples for Navajata Shishu Parikshana explained in Charaka Samhita and Kashyapa Samhita. So answering this question, so you should start with Navajata Shishu Parikshana is explained in Ayurveda, in Charaka Samhita, Sharirasthana, and in Kashyapa Samhita, Sutrasthana, in the Lakshanadhyaya chapter. And these are few examples of examination of newborn explained in Ayurveda. So coming to the lalata, how the lalata should be, he says it should be vyudam, dhrudam, samam. So it is vast enough, and it should be firm, and it should be uniform. And the more important thing is, he says, valibham, all the foldings. You can see in this image in this child. So the baby is suffering from facial paralysis of the left side. So you can see the baby is not able to close the eyes, the foldings, wrinkles over the face are vanished. So this valibham is very important in assessing the normal neurological status of the newborn, especially in terms of integrity of facial nerve. So how the nose should be, he explains the nose should be straight enough and mahochvasa. So it should be allowing the good amount of passage of air. So that means it should be void of any obstructions as such. And vamsha sampanne, it is very important. So nasal root of the nose should be properly formed. If there is depressed nasal bridge, so you see in various conditions like Down syndrome or congenital syphilis and all, where the nasal bridge is depressed. Then again continuing, he says, mahatyau hanau, mandible should be well formed mandible. So here you can see in this child, the mandible is receding inside. So that is called as micrognanthia, wherein you will be seeing in some of the syndromes like Peary-Robbins syndrome. So these are not the lakshanas of Ayushman Bala, and once these features are there, you are saying that child is not healthy and child is not having normal intrauterine development. Then moving further, he says vyudam upachitam uraha. Here you can see IUGR baby with intrauterine growth retardation, and ura should be vyudam upachitam. These are two important terms he uses. Vyudam is wide enough and upachitam well formed. Here you can see all the musculature of the chest is emaciated. So So this is not a sign of Ayushman Bhala. So these are all, when you go with all the features, you can uh, understand that how keenly they have documented the method of newborn examination in those days. So we should be proud enough to say that they had very keen observation regarding newborn examination with the facilities what they had at that time. And now we can, with the current evidences and current instruments and instrumentation and current advances of the technology, we can further work on it, and we can establish a newborn examination in Ayurveda in a better manner. Then these are all the anatomical parts he has discussed. Coming to the physiological part of newborn examination, he is very keen. Now also we exactly follow the same thing as a gold standard of examination, or the understanding of health status of newborn in routine postnatal ward rounds. So he says, Prakriti yuktani Vata Mutra Purisha Guhyani. So normalcy of the Vata, so that is baby should pass flatus, Mutra, and should pass urine, Purisha, it should pass feces at normal interval, normal quantity and normal color and texture. So this is what makes the features of healthy newborn in a nursery ward. Then Guhyani, the secretions of genitals. So these are all the things wherein we see in the babies, especially female babies, there will be vaginal secretions, and after 3 days, 4 days, there may be bloody discharge from the vaginal orifice. So these should be examined properly, and the anxiety of, these are all the physiological condition wherein the anxiety of parents should be nullified. Then he says, Yata Tata Swapna Prajagara Ayasa Smita Rudita Stanagrahanani. Very important part of normal physiology of newborn. So the sleep should be normal. Once the baby is fed with the stomach full of milk, baby should sleep for 1.5 hours to 2 hours to maximum 3 hours. So this is what we expect in a newborn baby. The Jagarana. Once the baby is alert, baby should be playful for at least a few periods. Movement should be normal. So this is what Jagarana. Then Ayasa. So exhaustion, after crying for a long time, after feeding for long duration, the baby goes for a phase of exhaustion, and then sleep, followed by sleep. Then Smita, smile. Rudita, cry. Cry of the baby should be normal in the sense baby should be crying in demand for feed. Baby should cry after wetting the nappies or the clothes, after passing urine and stool. So baby should cry for the feeding in regular intervals. So this is what normal Rudita. Then Stanagrahanani, breastfeeding should be normal, appropriate. Means baby should be taking breast milk in good quantity, in regular frequency. So these are all the important features of normalcy of neonatal physiology. Then he says, Yaccha kinchidapya anyat anuttamasti tadapi sarvam prakriti sampannam ishtam viparitam punaranishtam. If child is not following the normalcy of above said parameters, the baby is having some disease. You should find that. The best example is lack of feeding itself is a sign of many serious dreadful conditions of newborn, neonate period. So those can be hyperglycemia, it can be sepsis, neonatal sepsis. So these are all the possibilities. Whenever baby is not passing urine adequately, we see the cause for dehydration, whether there is insufficient lactation or there is insufficient stanagrahanani, insufficient taking of the feeds by the baby. So these are all the very practical, and we are actually proud to tell our students that Ayurveda has mentioned regarding newborn examination in that elaborate. Then Kashyapa says the similar thing, so I will not go into detail again. So these things, whenever student is writing regarding Navajata Shishu Parikshana in Ayurveda, so we, being evaluators, we look for these points. We see one thing, whether student has identified the context of reference, that is Charaka Sharira and Kashyapa Sutra. If naming the chapter, it is well and good, Jata Karmottara Adhyaya and Lakshana Adhyaya of Kashyapa Sutra. Then we see for whether he has touched a few of physical features. Those are Kesha, Naka, Twak. So these are all the features, and we see whether student has addressed physiological aspect or functional aspect. So that is this slide. Prakriti yuktani vatamutra purisha guhyani tata swapna prajagara. So these are all the things. Then, so these are all the explanations of Acharya Kashyapa. It is having multiple facets, and I think it is out of the scope of UG. Just you have to know that Kashyapa has also explained regarding Ayushman Kumara Lakshana in various structural and functional entities. So he explains Anguli, how it should be, then how Gulfa, how it should be, then Janu, Spik, how it should be. And here the important and interesting thing is, he is explaining the future prospects of the child. He is predicting if, for example, if Spichau, if Shushka Spik, if the gluteal region of the baby is emaciated, then in future he may suffer from infertility. So these are all the predictions what are observed by Acharya Kashyapa, and he has documented it in Lakshana Adhyaya, and in post graduation of Kaumara Vritya it can be discussed in detail, and in UG the students should know just that in Lakshana Adhyaya Acharya Kashyapa has mentioned the Lakshanas of Ayushman Bala. Vast explanation, I will not go into details of those. Kesha Bhumi, how the Kesha Bhumi should be. It should be Snigdha, Lohita, Nirmala, Nirvrana, Cha Prashasyate. The scalp of the newborn baby. So all these things we get in routine our OPD practice of newborn care. Coming to the examination, modern part of examination of newborn, that is in our contemporary science, newborn examination is elaborately discussed in textbooks of pediatrics. So basic thing we have to know is, while answering also, you have to touch prerequisites of newborn examination, because once you are not following this guideline, your examination will be misleading. So that's why the examination of newborn should be in warm thermoneutral environment. Good illumination should be there. The best example is if thermoneutral environment is not maintained, baby will be having acrocyanosis, your CRT will be delayed, capillary refilling time will be delayed, and you may misinterpret as it is some irregularity or abnormality in cardiovascular system. So the prerequisites of newborn examination should be very well taken care of. Baby is completely undressed, placed on a flat surface, flat and firm surface. It is not that you are placing the baby on a soft cushioned coach and you are examining. So you may miss a few aspects. So that's why the surface should be flat and firm. Then examiner's hand are warm and clean. That is very important. And clear knowledge of maternal and perinatal history should be there before proceeding towards newborn examination. That is very important. One small example I want to quote is if baby is delivered with meconium stained amniotic fluid. You are examining the baby for jaundice, icterus on the first day, second day. So it may interfere with your clinical examination of neonatal jaundice. That is Kramer's criteria what you are studying. So it may interfere. You may get the intensity of icterus is more. So you should have a clear knowledge of maternal history and perinatal history. Then newborn examination is done at 4 important junctures. So this is what we see whenever the student answers. We see whether he is aware of these instances of newborn examination. Newborn period starts from the time of delivery till 7 days, that is early newborn, and till 30 days or 28 days in late newborn period. So during this period, how you proceed with your examination. So there are 4 important aspects of newborn examination. These are various junctures of newborn examination. First and foremost is examination at birth, that is at the delivery room. Then first day examination or examination after 24 hours. Then comes the daily clinical screening, and at the end examination of newborn at the time of discharge. So whenever in the presentation of the answer student writes these 4 points, we become more assured that the student really knows the subject. So aim of the examination varies as per the juncture or time of examination of newborn. At the time in delivery room, newborn examination at birth or in delivery room, the main aim is to ensure smooth transition of the baby from intrauterine to extrauterine environment. So that is fulfilled with the objectives, that is look for respiratory and cardiac and central nervous system status, assess birth weight and gestational age, look for presence of fetal congenital anomalies, smaller congenital anomaly like polydactyly. So we are not worried at the time of delivery, but you are worried about the fetal congenital anomalies, like for example if baby is having tracheoesophageal fistula which is communicating into the trachea and lungs. Then if you are handing over the baby for normal feeding, the baby may aspirate. So these are all the important fetal congenital anomalies you should rule out at the time of delivery and to assess overall condition of the baby. First and foremost thing which comes in newborn examination at birth is APGAR score. As I told earlier, it precisely assesses the status of 3 vital systems of newborn. Those are respiratory system, cardiovascular system and central nervous system. This is very, very important, and I see most of the students commit mistake in this part itself. So APGAR score is essential part of your answer to 10-mark question of newborn examination, and it can be asked as a direct question. or sub question for 5 marks or 3 marks even. So this chart is very important, and if the student uh, presents the answer with this chart, so there is very less minimum scope for losing any mark. So appearance, so it should be very clear, the pale or bluishness or central cyanosis or complete bluishness of the baby. And acrocyanosis, so you give score as 1, and if totally baby is pink, then you give 2. The very important thing is the last part, R in APGAR, that is respiratory movement or respiratory effort. It is nowhere linked with the respiratory rate. So where people commit mistake is they start writing respiratory rate. It directly gives negative impact on the evaluator, that this student does not know the component of the APGAR. So that's why you should be very clear, and it is very simple and effective means of assessing newborn at birth. Then the other things, like it should be evaluated in 1 minute and 5 minute duration of life. So that is important, and the inference of evaluation of APGAR. So make it a point that APGAR does not decide that whether you have to proceed with the resuscitation, whether you have to proceed with the artificial ventilation. So these decisions are not taken based on APGAR, but APGAR gives you overall condition of vital systems of newborn, and of course it is helpful in determining the prognosis of the condition. So if the points out, if 7 more than 7 out of 10, then it is normal, and if 6 to 4, it requires immediate action, and poor prognosis if it is less than 3. So this is very important part of newborn examination. Then proceeding further, assessment of birth weight and gestational maturity. Birth weight should be measured within first hour of life. Then gestational age should be assessed based on physical features and neurological features, and you can divide it, the baby, into term, preterm and postterm. So the parameters, physical parameters, are used to evaluate the gestational age at the time of birth. Though we have Ballard scoring system, that requires a little bit time, which can be done later. Initially, while doing initial care of the newborn itself, you can assess all these features, and you can decide that whether the baby is term or preterm or postterm. This assessment of gestational age can be separate question for 3 to 5 marks. So that's why it becomes very important. The scalp hair, ear cartilage, breast nodule, external genitalia and plantar creases. So these are 5 important components of physical assessment of gestational age. Then moving further, in the newborn examination at birth itself, look for presence of fetal congenital anomalies like tracheoesophageal fistula, and examiner should always follow orifice counting method to see for some of the atrachas or imperforate anus like conditions. So all the orifices, in the sense it is anal orifice, urethral orifice, eyes, ear, nose, mouth, in detail the examination should be done to see any defects. Then look for midline defects. It is more frequently observed that developmental defects are observed in the midline, where the embryonic during the period of embryonic growth. So these are all the areas which have maximum potential to suffer from any of the congenital defects. Midline defects include cleft lip, cleft palate anteriorly, then exomphalus, omphalocele. So these are all the abnormalities seen in the anterior part, and posteriorly there may be defects of neural tube. Neural tube defects, it varies starting from anencephaly, meningocele, meningomyelocele, spina bifida. So these are all the things we have to rule out in midline defects of anterior and posterior. Then we have to rule out cyanotic heart diseases and mild ventricular septal defects, atrial septal defects, patent foramen ovale, patent ductus arteriosus may not produce any difference in the outcome in the newborn care. It can be addressed in later part of life. But if some of the fetal cyanotic heart diseases, congenital heart diseases, if those are there, those should be identified at the earliest. Then coming to the next part of examination at birth or delivery room. So those are systemic examination. It is not that you you do elaborate examination of each system, like it is mentioned in examination of systemic examination in adult or in pediatric perspective. But in newborn, you should be examining these systems within minutes. So respiratory system can be examined with just 4 points, that is respiratory rate, which is between 30 to 60, and there is symmetrical chest expansion, and there is absence of chest retractions, that is subcostal, intercostal and suprasternal retractions. Then there is no added sounds such as grunt. So grunt is very essential component of respiratory examination to rule out any impending respiratory failure in the baby. Then cardiac system. So there your examination should focus on pulse rate or the heart rate. Then capillary refill time, it should be less than 3 seconds. Usually it will be in between 2 to 3 seconds. Then color of the baby. So this ensures the integrity of cardiovascular system. Then the very important system is central nervous system, so which can be assessed by assessing the neonatal reflexes and tone of the muscle. Tone includes even the activity of the baby, attitude of the baby and position of the baby. If baby is in semi-flexed position, it can be understood that tone is good. If baby is moving its all limbs, then it can be understood that the tone is good. Then coming to the next part of newborn examination, that is first day examination or examination after 24 hours. Here aim is to conduct a detailed examination. There you are not having any restriction of time. So you can use ample time, but examination should be in detail. Objectives: assessment of anthropometry, detailed assessment of gestational age, then head to toe examination and detailed systemic examination of each system. In anthropometry, you have to again measure the body weight, length of the baby, head circumference, chest circumference, mid-arm circumference. Then coming to the detailed assessment of gestational age, that is new Ballard scoring system. So you are well versed in your routine classes, you have gone through this. So those are posture. This is your Apgar score is assessed with the help of two entities, that is physical maturity and neurological maturity or neuromuscular maturity. So in each part you have 6 components. The scoring will be from -1 to +5. First one is posture, then square window, arm recoil, popliteal angle, scarf sign, heel to ear test, So then physical maturity, their skin, lanugo, plantar surface, breast nodule, then ear and eyes, then the genitalia. So these components constitute a complete examination for determining gestational age in precise. So the total scoring may vary from -10 to +50. So if it is -10, it is supposed to be 20 weeks, and if it is 50, then it is 44 weeks. So the score should come somewhere around 35 to 40 in normal or full term babies. Then first day examination, that is in head to toe examination. In head you have lot of things to examine. I will browse it faster. So skull, in skull you have to look for any injury. So it may be any of these injuries: capitis accidanium, cephalohematoma, subgaleal hematoma, etc. So in face, so there may be various things. It can be milia, acne, hemangioma, and these are all, some are normal and some are abnormal. Milia is very normal, but it may create anxiety in the parents, and you have to examine and reassure the parents. Whereas various hemangiomas, you can see here, the first one is strawberry hemangioma and Port-Wine stain. Then here you can see dysmorphic, facial dysmorphism, so micrognanthia, depressed nasal bridge. So in case of Peary Robbins, in case of here hypertelorism in Downs, and mongoloid slanting of the eyes. So these are all the things. Low set ears. So these can be abnormalities. These are all the possible abnormalities what you are you looking for in detail, examination in detail. Then skin, you have to examine for jaundice. You have to examine for persistence of cyanosis. You have to examine for various hemangiomas, petechiae, and some desquamating lesions, like in case of ichthyosis, lamellar ichthyosis, you can see here in the picture. Then examination of abdomen and genitalia, umbilical stump, you examine for any of the discharges. There you have to differentiate between the normal jelly, Wharton's jelly, and the inflamed umbilical. So this is very important. Then look for any of the palpable mass in the abdomen. Then look for both the testes, whether those are descended into the scrotal pouch or not. Then look for hydrocele. Hydrocele, it is very common. Congenital hydrocele is very common, and you just do a transillumination and you will come to know it is a clear fluid, and you can wait for days to months for its spontaneous resolution. Then detailed examination of cardiovascular system, respiratory system, central nervous system, and special senses, especially the vision and hearing you have to examine, and hip examination. That is an important part in newborn, because that makes as early as possible, if you are identifying developmental dysplasia of hip or congenital hip dislocation, then you can give better outcome for the baby in future. Another important part of examination of newborn is neonatal reflexes. So there are many reflexes, but the important one are Morrow's reflex, sucking reflex, the grasp reflex, and tonic neck reflex, glabellar tap. So these are all the things what you have to write in your, you should not miss. And Morrow's reflex, it can be asked separately also for 3 marks, whereas neonatal reflexes as a whole can be asked for 5 marks. There you have to give a brief introduction of neonatal reflex, that is okay, these are all the reflexes which are originating from brain stem, that is subcortical region, that involves midbrain, pons and medulla. So as the cortex develops in after the period after birth, these reflexes will be resolved, and resolution of neonatal reflex is an important indicator of cortical development of newborn. So that's why in the initial period, in the newborn period, what examination we do regarding neonatal reflex gives us an idea regarding integrity of nervous system, central nervous system, and gives an idea regarding gestational age of the baby. Like all these primitive reflexes start from 26 to 28 weeks and then persist throughout. Whereas Morrow's reflex, so it has its own components, 4 components what you study, that is uh, uh, abduction at shoulder, extension at elbow, then again flexion at elbow and adduction at shoulder. So these 4 components. So whenever you are examining Morrow's reflex, you should look for whether it is present or absent, that is one part. Another part is whether Morrow's reflex is symmetrical bilaterally or whether it is unilateral. For example, if in case of unilateral Morrow's reflex, it may be indicating peripheral nerve injury like brachial plexus injury, or skeletal injury like fracture of clavicle or fracture of humerus. So Morrow's reflex individually has a lot of significance in newborn examination. So in the introduction, the student should write primitive reflexes are important part of neonatal newborn examination, and these gives you information regarding status of central nervous system, and it gives us information regarding skeletal and neuronal injury, and it also gives you information regarding gestational age. So with this introduction, you should start writing individual reflexes. Whereas we see all students start directly with the reflexes what they know, but with the introduction will always fetch you better mark. Coming to individual reflexes, okay, rooting reflex, sucking reflex, palmar grasp, plantar grasp, Morrow's reflex, tonic neck reflex, crossed leg extension reflex, stepping reflex and placing reflex, Gallant's reflex, Landau reflex, parachute reflex. Again, important part, but because of its nature, that is, it is reflex, we are discussing it under newborn reflex, but you should know that it is not a neonatal reflex. So these reflexes, this parachute reflex, originate after 8 to 9 months of age, and it stays throughout the life. So that is regarding first day of examination. Then daily screening. You have to look for feeding problems, exclusiveness and adequacy of breastfeeding, whether the breastfeeding is adequate, that is, whether sufficient enough, and whether the baby, you have to ensure baby is exclusively breastfed. Baby is not given any of the other feeds like cow's milk or formula feed without indication by the pediatrician. Then urine, you have to look for its frequency and quantity. Then stool, frequency and color, that is very important. As the day progresses, there will be initially there will be meconium, and then the transitional stool, and then the matured stool, that is yellow color. So you should give importance to all these features. Then the jaundice, its onset and progress you have to elicit. Then temperature, whether the baby is in cold stress. You have to examine the extremities and see that what is the temperature. Many a times in routine nursery care, baby goes for cold stress. You should be very keen. Especially you should give special attention whenever the baby is susceptible for hypoglycemia like condition. Once after birth asphyxia or baby with IUGR or preterm baby, these are always having chance for going for hypoglycemia and hypothermia. Once hypothermia is established or cold stress is present, baby will lose calories very fast and baby may land up in full-fledged hypoglycemia. So which causes irreversible brain damage. Then look for infections. Look the orifices, open orifices which act as portal of entry for infections like conjunctiva, the umbilicus which is raw, then skin for pyodermas. So you have to examine in daily screening, and examination at discharge is the repetition of all the above once again. So no anomalies or injuries are missed. Initial feeding problems are surpassed or not. Usually it is very common that all the primipara mothers suffer from adjusting with the feeding and feeding technique, and lot of anxiety regarding how to hold the baby, how frequently we should feed, etc. So when the baby and mother are with us for 3 days, 7 days, you should train them for all these things, whether it is surpassed or not, that you will examine again at the time of discharge. Then look for jaundice, whether it is present, or if it is after 5 days, 6 days, whether it has started regressing. So that assessment should be there. And functional murmurs which are seen after delivery should be settled down at least at the time of discharge. Then proper advice of feeding, cleanliness, immunization, etc. should be given at the time of discharge. So here we complete the 4 stages of neonatal examination, that is to be in precise, that is at birth. Then at birth means at the delivery room, then after 24 hours, then routine daily screening, then the examination at discharge. So these 4 components should be addressed by the student whenever he is answering a question on newborn examination. So the best simple thing is, if the question is asked as newborn examination, then deal with all these aspects of newborn, modern aspect of newborn examination first, and at the end you should write a small paragraph regarding Ayurvedic part of newborn examination. If Navajata Shishu Parikshana is asked, then as now we started presenting with the Ayurvedic part of newborn examination, you deal it in elaborate and give a brief note of examination of newborn in contemporary system, that is in the present day pediatrics. Then these are not for the exam part of thing. There may be other physiological conditions occurring in the baby which may be causing anxiety in parents, and these should be taken care of, addressed, and you should know that the milia you can see, and this is miliaria, wherein the fluid collections, fluid filled small vesicular eruptions over the face because of collection of sweat and other discharge. So Epstein pearl, you can feel it as a pustule in the soft palate. These are all the suckling callosities, so which may appear like blister, and congenital teeth, and caput succedaneum, cephalohematoma, neonatal acne, mastitis neonatorum, vaginal bleeding, vaginal secretions. So these are all the things, and so this I was talking as this is umbilical granuloma, and So here this is not the pus. Here the inflammatory signs are absent, whereas this can be the Wharton's jelly, what is remained in the umbilical stump after falling of the cord. You see, this is umbilical sepsis, the developing umbilical sepsis. You can see here in the right side picture, you can see the skin is also getting discolored, that is, it is becoming erythematous and indurated, whereas here it is healthy. Yes, so these are all some conditions. So here you can see that pyodermas after exfoliation. Here you can see the pyoderma. So these are all the web areas, are common areas of pyodermas. Color of the baby. So what can be the changes in color? This is reddish, and this is pale color. And the very important thing is you have to know the danger signs. Not feeding well, less active than before, breathing fast, that is tachypnea, moderate or severe chest indrawing, grunting, convulsions, floppy or stiff baby, the temperature either cold stress or hyperthermia, umbilical discharges, pustules, etc. should make alert the caretaker. So that part, if these things are written by if danger signs etc. are written by the student, then of course we feel like giving extra mark, the bonus mark. If you are for example, it is a 10-mark question, you landed up somewhere 8 or 7, you had written very well, but if you may land up 7 to 8, and if danger signs are written, then you may get half to 1 mark extra in the evaluation. So these things always you should take care of. Then as Masanumasika Garbha Vridhi, fastly we will finish it off. So everybody should by heart the shloka or the verse of Acharya Sushruta. So he very clearly and practically explained and in a concise manner. So he explained monthwise development of fetus. So Tatra Pratame Mase Kalalam Jayate. I think all the students have studied these things. So if question, how the question can come from this part is it may come for 5 marks, very rarely for 10 marks, but it is more towards Prasuti question than Kaumara Vritya question. That's why you may not get a long question on this in Kaumara Vritya. In Prasuti Tantra you may get. So there is no harm in studying it in detail. You can use it in both papers. So Masanumasika Garbha Vridhi. So the question can be write in detail regarding Masanumasika Garbha Vridhi. Straight question. Then they may ask as the question for 3 marks, write in detail, write in brief regarding development of fetus in 4th month, development of Garbha in 4th month, because you should address the issue of Dauhrida. And also, if you are mentioning in this monthwise development of fetus, if you are mentioning the difference in the understanding of concept of Dauhrida by various acharyas, like Sushruta explained it in the 4th month, whereas Acharya Charaka and Acharya Kashyapa, they explained it in the 2nd and 3rd month. So if this part is mentioned, again as I told earlier, you may get a half to 1 mark extra in the question. And very important thing to know to all the students is such positive impact of your answer and knowledge or depth in the subject does not confine to that question itself. It is carried forward for further questions. So once we are feeling that this child or this student has in-depth understanding of topic, then similar impact will be seen in next few questions also. So that's why knowing and presenting it in the answer paper becomes what beneficial, and it becomes a bonus. It fetches you bonus marks. At least in the whole question paper, answer paper of 100 marks, you may get 4 to 5 marks extra because of this your not in-depth understanding of the subject. So that's why we always say students that don't confine to passing marks or first class mark. Try to be 100% always, and which will give you more understanding, in-depth understanding of the subject, more excellence in your clinical practice in future, and also from the examination point of view you will fetch more marks. So take monthwise description of one acharya as the base. That is preferably Sushruta's explanation of monthwise development is good enough, and whenever we are looking for the answer on monthwise development, first we see whether the student knows the subject or not. Then we see whether student has written Dauhrida, mentioned Dauhrida in between the explanation. So that this gives, if student has given elaborate or appropriate description of Dauhrida, that means student has good understanding of the monthwise development of fetus or Garbha. Then okay, Panchame Manaha Pratibaddataraha, Shashte Buddhihi, Saptame Sarvanga Pratyanga Vibhagaha Pravyaktataraha. Then in Ashtama Masa, then Sushruta, Acharya Sushruta mentioned Navama, Dashama, Ekadasha as Prasava Kala. So these are all the things what students should write, and that gives completeness of the answer. Then coming to the current understanding of monthwise development of the fetus in the product of conception. So it varies. In the first 2 months you call it as initially it is zygote, then morula, then blastocyst, blastula and blastocyst. There will be implantation, and then development of embryo. Embryogenesis will be taking place, and till 2 months the product of conception will be called as embryo. Then what happens in the later, in the 3rd month, the fetus measures. Yes, this imprecise. If that question is asked for 10 marks, you have to write the current understanding of development, in utero development of product of conception. So it can be not in much detail in UG at least. So but it should contain some dimensions like length, how much length will be there, and what will be the weight of the product of conception at that age. So if these and the conspicuous development of some organs, or the gross development of some external organs or external projections linked with some of the organs. So for example, 9 to 12 weeks the fetus measures approximately. So after completion of 2 months, 3rd month onwards, you call it as a fetus. So it approximately 8 centimeter in length. Head is approximately half of the size of the fetus. Then external features such as face, neck, eyelids, limbs, digits and genitalia are well formed. Then the beginnings of teeth appear. So these are all the teeth in the alveolar cavities. Then the RBCs begin to be produced. So these are all the important events happening in these weeks of development, 13 to 15 weeks. That is after in the 4th month, the fetus reaches approximately 15 centimeter in length. Fine hairs, that is lanigos, are developed, start to develop, especially on head. Structures such as the lungs sweat glands, muscles, and bones continue to develop at this age. Then by 16 to 20 weeks, so that is 5 months, fetus measures approximately 20 centimeters. Lanigo begins to cover all skin surfaces. Finger and toenails, eyebrows and eyelashes appear. Then in 21 to 24 weeks, so that is baby, the fetus weighs around approximately 0.7 kg. So this should be there. So after completion of the Masanumasika Garbha Vridhi, you have to write a brief note on fetal development. The fetus measures approximately 38 centimeter in length and weighs approximately 1.2 kg by 7 months. So 7 months, 1.2 kg. So you can remember the important landmarks in between, that 38 centimeter and 1.2 kgs by 7 months. So these are all the things what you have to write in the answer of Masanumasika Garbha Vridhi. Yes, in the term, that is 48 to 53 centimeter, and by this baby is considered as full term, and the fingernails have grown past the tips of fingers. So there will be over the fingernails will be crossing the fingertips, like in case of post-term what we are saying. So it will be further surpassing the fingertip. So these are all the things what you have to address in Masanumasika Garbha Vridhi. So this is in precise regarding Navajata Shishu Paricharya and Navajata Shishu Parikshana, and Masanumasika Garbha Vridhi. And I think this video, this part will be helpful for all of you. Thank you.
Yes, sir. Thank you for this wonderful session, sir. Thank you for taking out some time from your schedule. And despite your busy schedule, you have conducted this session, sir. It was very useful.
Yes, thank you.
Thank you, sir.